How to lower triglycerides. What you need to know. When triglycerides begin to rise, you've gained a few extra pounds. Then your annual blood test comes back with a concerning result: high triglycerides. These fats, while a normal and necessary source of energy, become harmful at elevated levels. High triglycerides, like high cholesterol, can contribute to clogged arteries, increasing the risk of heart attack and stroke. The good news? There are effective, evidence-based ways to lower your triglycerides and protect your heart. Why triglycerides matter for your health. High triglycerides are often one component of a broader health issue known as metabolic syndrome, a cluster of conditions that raise your risk for serious diseases. These conditions include low HDL, good, cholesterol, high blood pressure, abdominal obesity, elevated blood sugar. When these factors are present together, your likelihood of developing heart disease, stroke, or type 2 diabetes increases significantly. How diet plays a key role. Everyday food choices can have a direct impact on your triglyceride levels. That creamy coffee drink, late-night ice cream, or greasy sandwich may be more than just empty calories. They can push your triglycerides higher. One of the most common causes? Consuming more calories than you burn, especially from refined carbohydrates and saturated fats. Foods high in sugar and unhealthy fats, such as red meat, cheese, whole milk, and processed snacks, are common culprits. Cutting down on sugar is critical. One of the fastest ways to lower triglycerides is to reduce sugar intake. Simple sugars, and particularly fructose, even from fruit, can significantly raise triglyceride levels. Pay close attention to added sugars in your diet. High-risk foods include soft drinks and fruit juices, candy and baked goods, flavored yogurts, most breakfast cereals, ice cream, and other desserts. Reducing these can make a measurable difference in your blood lipid profile. Uncovering hidden sources of sugar. When it comes to lowering triglycerides, cutting out obvious sweets is only part of the solution. Many processed foods contain added sugars that are not immediately recognizable. Learning how to read labels is essential. Look out for ingredients such as brown sugar, corn syrup, any word ending in ose, e.g., dextrose, fructose, glucose, lactose, maltose, sucrose, fruit juice concentrates, cane syrup or cane sugar, honey, molasses, malt sugar, and raw sugar. Reducing your intake of these hidden sugars can lead to a significant drop in triglyceride levels over time. Focus on high-fiber foods. Fiber is a powerful nutrient when it comes to heart health. Replacing refined carbohydrates with high-fiber foods can help lower triglycerides and improve your overall metabolic profile. Choose whole grains over white flour products. For example, start your day with steel-cut oats topped with berries instead of a sweetened cereal or bagel. Enjoy a fiber-rich salad with vegetables and chickpeas at lunch. Replace starchy sides like potatoes or pasta with quinoa, barley, or brown rice at dinner. Soluble fiber, in particular, has been shown to help reduce triglycerides and improve lipid metabolism. Choose healthy fats wisely. Fat isn't the enemy. The type of fat matters. Focus on incorporating monounsaturated and polyunsaturated fats, which support cardiovascular health and can help lower triglycerides. Include foods such as avocados, walnuts, skinless poultry, olive oil, and canola oil. Avoid trans fats entirely. These are often found in processed snacks, margarine, and baked goods and can significantly raise triglyceride and cholesterol levels. Also, limit your intake of saturated fats commonly found in red meat, cheese, and creamy desserts. Replace red meat with fatty fish. Fatty fish rich in omega-3 fatty acids are among the most effective natural triglyceride-lowering foods. Aim to include fish in your meals at least twice per week. Excellent choices include salmon, mackerel, albacore tuna, herring, lake trout, sardines. Next time you're dining out or planning a meal at home, opt for grilled fish instead of a steak or hamburger. Incorporate omega-3 rich plants and greens. In addition to fish, several plant-based foods are high in omega-3s and support healthy triglyceride levels. Include more of these in your weekly meals. Walnuts. flax seeds, spinach, kale, Brussels sprouts, leafy salad greens, beans, and legumes. These foods offer both fiber and healthy fats, making them excellent choices for heart health. Should you consider an omega-3 supplement? Omega-3 supplements may offer benefits, but they are not necessary for everyone. Consult your healthcare provider before starting any supplement regimen. While capsules containing EPA and DHA, the most effective forms of omega-3, can help reduce triglycerides, high doses may increase the risk of bleeding or interact with medications. A healthcare professional can help determine whether dietary changes are sufficient or if supplementation is appropriate based on your health profile. Cut back on alcohol. Regular alcohol consumption, even in moderate amounts, can raise triglyceride levels in some individuals. If you enjoy unwinding with wine, beer, or a cocktail, consider healthier alternatives. Try sparkling water with a splash of lime or a tangy, unsweetened herbal iced tea. For heart health, it's recommended that women limit alcohol to no more than 1 drink per day and men to no more than 2. However, if you already have elevated triglycerides, even small amounts of alcohol can make matters worse. Eliminate sugary beverages. One of the simplest and most effective steps you can take to lower triglycerides is to cut out sugary drinks. Beverages like soda, sweetened teas, and energy drinks are loaded with fructose, which is strongly linked to elevated triglyceride levels. Experts recommend limiting sweetened drinks to no more than 36 ounces per week. That's roughly 3 12-ounce cans of soda. Replacing these with water, unsweetened teas, or sparkling water can lead to rapid improvement. Lose excess weight. Excess body fat, especially around the abdominal area, is closely linked to high triglycerides. Weight loss is one of the most impactful ways to bring your levels down. The good news is that even modest weight loss, as little as 5% to 10% of your body weight, can make a significant difference. Focus on long-term, sustainable changes in eating and activity rather than short-term crash diets. Make exercise a habit. Regular physical activity helps reduce triglycerides, burn calories, and support weight loss. Aim for at least 30 minutes of moderate-intensity exercise, 5 days per week. Activities that get your heart rate up, like brisk walking, swimming, cycling, or group fitness classes, are especially effective. With consistent exercise, it's possible to reduce triglycerides by 20% to 30%. If you're just getting started, begin with activities you enjoy and gradually build up intensity and duration. Know your numbers. A simple blood test is all it takes to measure your triglyceride levels. Your doctor may also check for underlying conditions that can contribute to high triglycerides, such as diabetes, obesity, hypothyroidism, and underactive thyroid, kidney disease. Here's how triglyceride levels are categorized. Normal, less than 150 milligrams per deciliter. Borderline high, 150 to 199 mg/dl. High, 200 to 499 mg/dl. Very high, 500 milligrams per deciliter or more. Regular checkups are essential to track your progress and guide your treatment plan. When lifestyle changes aren't enough. While many people can successfully lower triglycerides through diet, exercise, and weight management, others may need additional support. If your levels remain high, your doctor may recommend medications such as fibrates, niacin, statins, prescription-strength omega-3 fatty acids. These treatments are usually considered when lifestyle changes alone haven't achieved the desired results. Your physician will evaluate your full lipid profile to determine the best course of action. Managing your triglycerides is not about perfection. It's about making steady, informed changes that support your long-term health. By improving your diet, moving more, limiting alcohol, and working with your healthcare provider, you can take control of your heart health and lower your risk for serious conditions like heart disease and stroke.